歡迎大家出席今日。
Welcome to the press briefing. We have today Dr. Edwin Choi, Controller of the Center for Health Protection, Dr. Chong Chok Kwan, Head Communicable Disease Branch of the Center for Health Protection, and Dr. Larry Lee of the Hospital Authority. First, Dr. Choi will say a few words. Good afternoon, members of the public and the media. I would like to report the latest situation about the epidemic. We have seen rapid development of the epidemic. Today, we have 1,514 prelim positive cases, and in the past few days, we have recorded over 3,000 cases. Today, we have over 1,500 preliminary positive cases. Dr. Chuang will give you more details later. I would like to share with you some of our observations. In this wave of outbreak, we see that there are many outbreaks in homes for the elderly and disabled that involve both the residents and the workers, and this is our biggest concern, because at the start of this wave of epidemic, we said that if the disease is spread to homes, and there will be serious consequences, because many of the residents have not been vaccinated, and if they become infected, they could easily have complications. Now, there are over 42 homes involved with over 80 residents and employees infected. There are also some cases death cases involving the elderly, and this is not what we want to see, and it's very worrying, because the vaccination rate among the elderly remains low, and if they become infected, there could be serious consequences. But then we see also that perhaps because of the epidemic, many residents in these homes now are prepared to get vaccinated, and they have the support of their family members. So we see that many home residents would like to get vaccinated as soon as possible. So we'll be contacting the various doctor groups and so on to help administer vaccine to these home residents. And with the evolving epidemic, we have to update our strategies, because we want to prevent the collapse of our healthcare system. Starting from the 8th of February, there is a new community isolation facility at Penny's Bay to receive patients with low risk. So Penny's Bay is originally a quarantine center, but our rooms are being freed up for isolation purposes. There are some 1,500 units at the Penny's Bay are now used as community isolation facilities. And then for 3A, 3B, and 4, these three phases of the Penny's Bay, there are about 2,000 units. These will be vacated. So these units will be for patients with needs. At the same time, the government has launched a Stay Home Safe scheme. The after assessment for close contacts or family members living with close contacts, there will be 4 days or 14 days of home quarantine. In the past days, we have issued 1,091 home quarantine orders. So some 3,478 people have either completed their home quarantine or are in the process of their home quarantine. This involves 1,415 households. Now, we will assess various aspects to see if someone is suitable for home quarantine. For example, the living condition, the medical condition of the individuals, and so on. And if after assessment we believe that home quarantine is not suitable, then we will arrange to send these people to quarantine facilities, that is quarantine hotels for isolation. And as at yesterday, there are some 2,300 people being quarantined at 8 hotels. Now, I would like to report to you the latest trend of the epidemic. I hope you will be prepared for this. Now, since 2 years ago, this is actually the toughest battle we're fighting against the virus. We believe there will be a high number of infection cases in the near term. But then we want the public to cooperate with us. Please stay home as fast as possible. Please refrain from attending any gatherings, because we want to cut off the transmission chain in the community as soon as possible, but that needs time, so we need your cooperation. And then residents are probably much bothered by the testing arrangement. Now, we need to issue compulsory testing notices, CTNs, and then members of the public have to get tested at various locations. We see there are queues and long waiting time at some of the community testing facilities. We would very much like to improve that situation. So we are working hard to boost our testing capacity. We know that there is still strong demand without enough supply of the testing facilities. We want to divert testing resources to the high-risk groups. So we have reviewed the criteria for including premises for compulsory testing. Now, in a building, if there are 2 units with confirmed cases, then we will issue CTNs. And the CTNs will also be issued through the Leave Home Safe app. And so please take note of that. But then we want to avoid, we are reducing we are rather lowering the requirements for compulsory testing, but still, if you think you're at risk, please try to stay at home as far as possible. And then for preliminary positive cases or suspected cases, well, the individuals involved have to stay at home for a long time before they are sent to hospitals. Because I'm sure you are aware of this, our healthcare workers have been working very hard to serve the public. We are seeing an surge in cases, so colleagues of the hospital authority are under immense pressure to arrange for people to be admitted to hospitals. In a moment, Dr. Lee will tell you more about the arrangement. I understand the hospital authorities increase their manpower, and they try to send people to either the quarantine centers or the hospitals even late at night, and so we are slowly improving the situation. But then at the same time, we're seeing an increasing number of cases, so it may not take just a few hours for people to be sent to the hospitals as we've done in the past. So please, do appreciate that it may take us a longer time, even several days, for people to be sent to hospitals. Now, so while you're waiting, please pay attention to a number of points. That is, while you're waiting for hospital admission, even if it's for a few hours or for a few days, you have to note the infection risk. For other family members in the same household, they must all wear masks. Well, I'm sure people don't usually wear masks at home, but if there is an infected person in the household, so the infection risks are there and everybody should wear a mask. Second point, you have to be careful about the disinfection, and then thirdly, try to avoid any contact. Of course, it may be difficult for some households because of the housing condition. But then, if there is an infected person in the household, the person should try to stay in a room as far as possible while waiting for hospital admission. As for disinfection, I will suggest that you keep stock of disinfectant, such as bleaching powder, bleaching agent, or bleaching pills, because family members may share a bathroom, so there's need for proper disinfection in the bathroom to prevent infection. Dr. Chuan will be giving you an update of cases in a moment, but I'd just like to remind you that we are now seeing the fifth wave of outbreak, which is the most severe since the start of the epidemic 2 years ago. So we have to stay highly alert. Please make sure you pay attention to personal hygiene and environmental hygiene, and more importantly, please avoid gatherings. And if you have not yet been vaccinated or you are eligible for the third dose, please do get vaccinated very soon. So we must work together and fight this virus together. Thank you. Dr. Chuang?
Good afternoon. As of last night, we had 1,514 cases that tested positive. 17 cases carry the L452R variant, that is suspected Delta variant. And then 1,419 cases tested negative to Delta, so they're suspected Omicron carriers. A small number of cases are pending further tests. Out of the 1,514 cases, 5 of them are imported cases. As for the rest, 1,509 cases are local infections. So far, more than 1,500 preliminary positive cases have been recorded. I will cover some cases about elderly care homes. Many such care homes are involved. Infections or even outbreaks in such. There's one Lutheran church called Wangzhennam Konglai Wuyang Yun. There are staff members infected, but an investigation is going on to find out if there are further close contacts. There's a Buddhist care home, Legaseng Wulingon No Yun. There's a relief worker who tested positive. Investigation is also ongoing for this particular care home. And Tonghua Group of Hospitals Law Wang Yongmun Care Home cum Daycare Center. It's a place in Shatin. There's a resident there who tested positive. This person stayed in a room for 8 residents. There's another called Fengkai Wulingon No Yun. There's a worker, clerical worker there. No resident had to be quarantined, but some close contacts may have to be quarantined. In Shamshui Po, there's a care home called Hengnam Wulo Yun. There's a kitchen worker who tested positive. 3 elderly residents there tested preliminary positive. Those on the second floor will have to be quarantined. There's another facility on Boundary Street, Shenyang Elderly Home. 17 residents plus 6 workers there tested preliminary positive. So these people, in fact, everyone on the first floor have to be quarantined, including the staff there. In Choi Wan Ko Care Home for the Elderly, there's a worker and at least 5 residents there tested preliminary positive. They stayed on the same. Everyone on the same floor have to be quarantined. There are also many other care facilities involved when we're still investigating such cases. Over to Dr. Larry Lee. Good afternoon, everyone. Over the past 24 hours, the HA reported 781 cases. 145 patients were discharged upon recovery. In total, 14,183 patients have been discharged. 1,939 patients are receiving isolation, receiving treatment. At Nantou Hospital, Hong Kong Infection Control Center, HA Infectious Disease Center, AWE Community Treatment Facility, and 15 hospitals. I want to report 3 cases of deaths in Queen Mary Hospital. A 98-year-old male patient, case number Y19609, tested preliminary positive at the rapid test at the hospital. On the 9th, he was hospitalized and was confirmed with COVID-19 at the A&E department. During the isolation treatment, his condition deteriorated. At 7:59 today, he passed away. He's unvaccinated at Tumon Hospital, a 75-year-old male patient, case number 10978. On 4th of February, he was admitted to the outpatient to Tumon Hospital, and then on 9th, he tested positive. His condition deteriorated. As by 1:51 p.m. yesterday, he passed away. There was a 4-year-old boy. At around 3:30 a.m. yesterday, he was taken to the A&E department at Pokoi Hospital. He was found to have stopped breathing and heartbeat. Resuscitation was performed. At 4:16 a.m., the boy passed away. The healthcare staff took a specimen for the boy. The test came back positive to COVID-19. The case has been referred to the coroner for follow-up. As patients in severe and serious conditions, there are 3 in critical conditions: 84-year-old male, 14814 at Cheung Kwan O Hospital, a 97-year-old male, 18489. A third patient, an 80-year-old male, case 19224 at Yan'an Hospital. The first and third patients have no vaccination records, but the second have been jabbed. 16 serious cases are still staying at 16 public hospitals. As for the discharge criteria, from today onward, there will be revised guidelines. When two specimens taken 24 hours apart and they come back with CT value at above 30, or if they test positive to IgG antibody, at least one of them is being negative, and at least one PCR test comes back with the value about 30, or if the antibody test turns positive after negative, and then at least one PCR test comes back with CT value over 30, the HKU has worked with HACE, has conducted a study suggesting that CT value of over 30 means we cannot culture the virus anymore. So we are basing our revised guidelines on science. The Joint Scientific Committee of the Department of Health agreed with our decision. Today, we have roughly 50 staff members preliminary positive. Most of them got infected in the community. 20 or so patients have been listed as close contact. In terms of admission screening, 9 patients have been found preliminary positive. Roughly 60 patients staying in the same wards have been classified as close contacts. We're preparing the detailed information, and they will be disclosed in the press release we will put out later on. In terms of the preliminary positive patients, I want to make an appeal here. Over the past week, there has been much debate and discussion about what we should do with preliminary positive patients. There have been some misconception as well. We understand the public concern about this matter, so here's our position. For those who test positive to the rapid antigen test, stay calm, stay home. Get someone to take the deep throat saliva bottle for the confirmatory test. If that's impossible, get a logistics or courier company to help you collect the specimen bottle. If you get an SMS message saying you're preliminary positive, for those with no or mild symptom, stay home. The Department of Health will arrange for an ambulance to take you to a hospital as soon as possible. While you're staying home, pay attention to the infection control system. The Patriot Hospital Authority Community Health Call Center will call you, and they will find out what you need and provide you with health-related information and find out whatever way they can help. There will be, the government websites have also made available relevant information. The A&E departments of our hospitals are very busy at the moment. Many patients are waiting for the confirmatory test results to avoid adding to the strain on the A&E departments and hospitals. Those with other mild medical needs, you can go to general outpatient clinics or go to a private doctor. Some people have misconception about this arrangement. By other medical needs, we are talking about medical conditions other than COVID, such as mild injuries or other forms of physical conditions. Our private doctors have been very helpful, helping alleviate the strain on public hospitals. As for COVID patients, we will do our best to look after them. Some may have no or mild symptoms. They may not be able to be taken to hospitals immediately, but for those with serious conditions or for the elderly or children, we will prioritize hospital admission for them. I hope you can understand that the COVID has been developing rapidly. We have seen exponential increases of cases from hundreds of cases per day to over 1,000 of cases per day. Given the rapid development of COVID, we have to keep revising our policies. We will announce such updates at press briefings every day and explain things to you. And given the way COVID is developing rapidly, there may be misconception or misunderstanding. So I'm calling for public understanding. I know it's tough for everyone. Our healthcare workers are working very hard at this critical juncture. Our strategy and our response may be changing from time to time, so we will do our best to explain things to you. The floor is now open to questions. Please put up your hand. I'll call the capacity of the microphone. Please identify your media outlet before putting your questions.
In the middle, the lady in pink. I'm from TVB. Good afternoon. First, now you have relaxed the criteria for compulsory testing for a whole block. There has to be 2 units involved with cases. But then the epidemic is so severe. Why are you relaxing the requirement for testing? Is it because we don't have enough manpower? And would that lead to more risks? Another question. That 4-year-old boy who died suddenly. Now he's certified dead on admission to hospital, and then you found that he's a positive case. Have you found out the source of infection? Where has he been? And when he went out to for playtime, he came into contact with quite many children. So what are you going to do about that? And then we know that there is delegation that's gone to Shenzhen for a second meeting with the infection control experts in Shenzhen. So would you be seeking assistance from the central authorities? If so, what sort of assistance are you seeking? And then Professor David Hui is suggesting lockdown, a city lockdown. So how possible is that? First, about the change in the compulsory testing criteria and the measures we consider in future. And I'll first respond to that, and then I'll ask Dr. Chuang to respond to you on the cases. First, we are adjusting the requirement. You know, there are 1,500 cases today. If we go by our previous arrangement, then we talk about several thousands blocks involved. And if we could do compulsory testing for several thousand blocks, yes, we'll be able to find all the cases as soon as possible. But then we may not be able to keep up with boosting our testing capacity. That's why, as the next step, we must first boost our testing capacity before we could keep up with the surge in the number of cases. So that's why we want to focus our resources on the highest risk areas. That is where there is an outbreak. Yes, if there are no more than 2 cases in a particular block, and then we don't issue a CTN, it's possible, yes, we may miss out some cases. That's why we need the cooperation of residents. So even if we have not issued a CTN, everyone should try to avoid going out as far as possible, because that's the best way to prevent the spread of the disease. And of course, in future, we hope that we could also rely on voluntary testing and some rapid testing facilities. If eventually we're able to enhance our testing capacity to a certain level, we may change our strategy again. So we could change our strategy anytime, having regard to this development of the epidemic, and so we keep making adjustments. And on your other point, will there be more stringent social distancing measures? For example, will we lock down certain areas, or even will there be a citywide lockdown? Well, we can't rule out any possibilities, because you can see we are stepping up measures gradually. Now, for this wave of outbreak, as you could see, compared to previous waves, we have adopted more stringent measures, and we hope these measures will work. But if they don't, there is the possibility that we may roll out even more stringent measures. But of course, we have to watch the development. Now, you mentioned the delegation led by the Chief Secretary of Administration to meet with Shenzhen experts. Unfortunately, I don't have any information about their communication, because they are still in discussion. But we hope that, of course, in the past few waves of outbreak, we've received much help from mainland experts, because they have the experience. And when necessary, we would like them to give us some support too. For example, in the past, they help us to boost our testing capacity, like the Huayan laboratories and so on, and even the supply of manpower. And so for this wave of outbreak, of course, we will need their help in some way. But at this point, I don't have any information to share with you, but I believe later on there will be information for you. Well, your case is the same as other cases. We will try to trace the source of infection and close contacts. Over here on the last row, the lady. I'm from Commercial Radio. Can I ask for more details about the 4-year-old boy at the Pok Oi Hospital? So far, what is the cause of death from your investigation? Is it related to COVID? Did he have any chronic disease, and was there any onset of symptoms, or did he have symptoms or not? Another question is how many patients are waiting to be admitted to hospitals? From diagnosis to hospital admission, on average, how many days would that take? And what criteria do you adopt to determine on priorities of cases? Now, we've seen cases that patients not been admitted to hospital, and there's already cross-infection in the household. So would you have other ways to address these issues? For example, reverse isolation. And then for residential care homes, how many of the residents, how many homes will you need to remove the residents, and how many are to be quarantined and so on? Now, perhaps Dr. Chuang could first give you some information about the 4-year-old girl. Well, for the 4-year-old boy, the information I have at hand is that he started to have a fever from the 9th of February. He didn't have any chronic disease. On about 11th February, he vomited once, and then his condition deteriorated. That's all the information I have at hand. Dr. Chuang. Yes, a fever starting with the fever on 9th of February, and then admitted to hospital on the 11th. And then about sending patients to hospitals, Dr. Lee will give you some information. Now, I don't really have any exact number as to how many patients are waiting to be admitted. But I understand that patients do have to wait several days before being admitted. It is not desirable, and we ask for the understanding of the public. At this point, we would like to first take in the priority patients mentioned earlier. That includes the elderly and children. For other patients with mild or no symptoms, they may have to wait a little longer. And then we'll arrange to send them to our various community treatment or isolation facilities. To add to what Dr. Lee said, if, say, there are preliminary positive cases that need to be sent to hospital, it's very possible that the household close contacts will isolate at home, and we'll give them a quarantine pack. And if things work well, then the preliminary positive cases would have left home and been sent to hospital. But because we have, a serious epidemic, and so while we try very hard to send preliminary positive cases to hospitals, and if there's need for home quarantine, we have a hotline for people to call. And then when they call, we'll see if there are any special circumstances that make it undesirable for home quarantine to be arranged. If so, then we'll arrange for those persons to be sent to quarantine facilities. So this is what is called the reverse approach, as mentioned by some experts. But it's not the exact same approach. For people who need to leave home, probably they aren't many in number. And if the health condition of family members is good, then we will try to work with the hospital authority colleagues, and we'll try to send the preliminary positive case to the isolation center as soon as possible. That would be the best way. And in any case, we will exhaust all means to try to minimize the infection risk. For residential care homes for the elderly, there are now 42 homes with infected residents and workers. If there's need to evacuate residents from a home, we would like to send them to our AWE facilities for isolation. Well, there is limited space at AWE. That's why we've adjusted our strategy. So if there's limited space, when there's limited space at AWE, then maybe for the first 7 days of quarantine, when it's over, then we allow them to go back to their homes for the remaining quarantine period. well, there's a scientific basis that is maybe in initial stage and the infection risk becomes very low, but then even when they're sent back to their homes, there will be need for other infection control measures. As for quarantine, in situ quarantine, that is, we find if we think that there's a high risk of infection, and if we want to do in situ quarantine, we will proceed with great caution, because if things are not managed properly, then there could be a major outbreak in a home. But if, say, so far there's one case, there's a home that is suitable for in situ quarantine, because there are individual rooms for the residents. But then if we want to do in situ quarantine for all elderly homes, we really have to assess the risks. And if there is a risk of transmission, then we will need special facilities for quarantine purpose. Number of residents evacuated is that yesterday there are 16 homes where we need to evacuate the residents. For the other homes, we're still doing investigation.
Next, lady over there. I'm from Now TV. First question. We're seeing more than 1,000 cases per day. Would you describe that the COVID situation here has spiraled out of control? You're saying just now about ramping up testing capacity, but isn't that already overdue? And now that you have tightened the requirements for compulsory testing notices, and so some cases may get overlooked, does it mean that there may be more silent transmission going on these days? And even if you do get to ramp up testing capacity later on, it would be too late. And about hospital admission arrangements, many people are still waiting for hospital admission. Do you have any plans to get off-duty discipline services officer to drive coaches, the 26-seaters, to take the patients to hospitals or to Penny's Bay? Are there plans in that direction? Can you tell us more about that? Some members of the public believe that the death rates in this wave of outbreak is similar to flu outbreaks in the past. Can you tell us more in terms of our fatality rates? How does it compare with the previous flu outbreaks? Why do you think people have this belief? I'll start by addressing the COVID situation. Previous figures compared to what we have now. Now we have more than 1,000 cases now, but previously we had maybe dozens of cases. But it's hard to tell where COVID is going. In some places, other countries, they have more than tens of thousands of cases per day. Now we have more than 1,000 cases per day. People are asking, has case count peaked yet? It's hard to say where this will be going. Based on the figures we have now, the social distancing measures are working to an extent because they are slowing down the transmission of the virus. But how much can it slow down the transmission? And how fast is the virus spreading? That would depend on public cooperation. Contact tracing is still going on. We're still identifying close contact. Home quarantine is being implemented, and if possible, quarantine at facilities, testing will keep going. But the public cooperation is the most important part of it. If public mixing keeps going on and family gatherings keep going on, then we will see more and more cases. The current figures suggest that we really have to ramp up the capacity at this moment. Doesn't mean it's overdue, it has come too late. You can look at it this way, we're preparing for possible further outbreaks in the future, so it's about the perspective. And about hospital admission arrangements. We have ambulance officers in charge of these matters. Maybe Dr. Leo Lee can tell us more in a moment. There has been some changes in the past. We had one ambulance per patient, but now we have many COVID patients, so the response has to be calibrated. You can send every patient to the hospital quickly if we stick to our old practice. So now we may need more different vehicles that can accommodate more people. It's about sending COVID patients to our hospitals or isolation facilities as soon as possible. As for the drivers of such vehicles, I don't have the information at hand. Does it mean that COVID has turned into something as mild as flu? It has to depend on the science. I'm looking for something from the international organizations, say from the World Health Organization. The WHO has been advising countries not to treat COVID as flu because COVID is something new. And it may not be the same thing with the flu in terms of the impact COVID has on people. So look at what the WHO has been saying. We should not underestimate where COVID is going. COVID virus mutates, changes quickly. We now have Omicron, but there's no telling if Omicron may turn into something else. It could turn into something that hits particular groups hard, and it could lead to more complications and more fatalities. We know flu has been around for a long time. We know how flu changes, but with COVID, it's hard to tell where COVID will be going. So you can't equate COVID with flu. So we're now in a tough situation with COVID. So we all need to work together and have faith and pay attention to our health measures. And don't be dismissing COVID just because of the mild symptoms. Avoid gatherings. Maybe Dr. Chuang will have more to say on this, or Dr. Larry Lee. I will say more about the hospital admission. There were seen surges in confirmed cases. Some patients are still waiting for hospitalization, and that's not an ideal situation. So the hospital authority is exhausting every option out there. We have found that for many admission cases, there are patients requiring transfer from hospital to hospital. Some people may have to transfer to community treatment facilities. We're transferring a lot of patients. That adds to the heavy burden on the need to transfer patients to different places. So starting from yesterday, steps have been taken. We thank the workers who have been helping us transfer patients to different facilities or hospitals, and they're helping us all along. They're transferring patients from hospitals to places like the Asia World Expo or the North Atlanta Hospital Infection Control Center or to Penny's Bay. We have the right kind of infection control training for them, and we also provide PPE or personal protective equipment to them. We thank them wholeheartedly. Next.
Over there at the back, the one in green, please.
First of all, would you be able to provide more details on the case of the 4-year-old boy who died overnight? Any clues at all, even though the case has been sent to the coroner's court, any clues on the likely potential cause of death, whether it's related to COVID? And my second question is, Dr. Choi, can you talk about your advice now that there are more people who have to wait potentially for up to days even after they test preliminary positive at home, but many of them actually live with their families. So can you give your advice to those families who may be living with a preliminary positive patient? And can you also talk about whether the government has discussed a threshold or criteria, a set number or figure, any criteria that the city may have to go into a citywide lockdown, and whether the authorities are making necessary preparations for that as you expect more cases to surface in the coming days? Thank you.
Okay, thanks for questions. So maybe I'll let Dr. Lee to respond to the clinical information of the 4-year-old boy, and Dr. Zhong to respond to the epidemiological investigations on the boy, and then I'll explain to you some advice for the home quarantines, which their family members who are tested positive are still at home, and any plans for the further enhancing our social distancing measures. Okay, Dr. Lee, please.
Okay. The information that I had is the 4 years boy without any major health problem before, and he developed fevers on the 9th of February. And 2 days later, and he also have throw up. And after throw up, he rapidly deteriorate and brought into the emergency department of Bok Hospital at around 3 o'clock in the morning.
Dr. Zhong.
I think the possible sources of the boy is still under investigation. I understand some members of the family may have symptoms, but the exact cause is under coroner's investigation.
So it is not very desirable for people who test positive to wait at home for days before transferring to hospital. But as you may be aware that the cases, the number increased so rapidly that Dr. Lee has explained earlier that colleagues in the hospital authority are trying their best to transfer and also to accept these cases to the isolation facilities and also to other hospitals. And indeed, there are chances that the home quarantine family members are still with the infected family members for a certain period of time, like 7 hours or days. My advice to them is they have to be prepared for these situations, especially in these emergency situations. And I would advise and appeal to members of the public to get prepared, and especially to take note of the possible transmission risk from the family members. I advise they have to wear masks at home, which is not quite often. Members wear masks at home. They should wear a mask at home if there are family members who tested positive, and try not to share utensils. And if possible, those infected family members should stay in their room and to avoid mixing with other family members or dining together. I also advise to have a thorough disinfection of the family's environment and to use some toilet chlorine tablets as a measures to reduce the transmissions in the toilet environment. So, but I think all the healthcare professionals and all our the colleagues in the hospital authorities are trying their best to speed up the transfer of the cases to the hospital, and I think the situation will be improved further on. So for the further lockdown or enhance our social distancing measures, I think we need to have some time to review the effectiveness of the current social distancing measures, and there are no a hard criteria to trigger any lockdown, but we have to consider a basket of factors before we decide a more drastic social distancing measures.
One other English question, please.
Some English questions from the South China Morning Post. So Hong Kong ministers today are visiting mainland Chinese counterparts for help. Based on the situation right now with the pandemic in Hong Kong, do you admit that the city's public health system is overwhelmed, or are there needed some other resources to steer us back into the right direction? And if so, is the additional help focusing on testing and vaccination rather than dealing with serious conditions of COVID-19? And my second question is about the sending people to hospitals again. On one hand, people who test preliminary positive or are confirmed positive are anxious and want to be sent to the hospital or isolation faster. But at the same time, the hospital authority has asked people to be patient if they test positive with the rapid test kits. So is there any concerns, or is there any point in sending people to treatment if they are maybe 3 or even 4 days late, given that the the discharge criteria has also been changed to a CT value above 30 plus.
Okay, thank you. So maybe I'll let Dr. Lee to respond to the treatment options for those infected persons after days. And I'll respond to the present public health situations and also the communications of our Hong Kong delegates with the mainland counterparts.
So we understand there are many patients queuing up for their admissions now. So our strategy is try to increase the capacity, and you understand that we try to increase the capacity of the isolation facility with the Penny Bay. And actually, we mentioned about we try to increase the capacity from phase 1, 2, and now to the phase 4 and 5. And to on the other hand, we also revised the discharge criteria. And now down to the CT values, 30 2 times, and also some other criteria. And we wish that can be speed up the admission process and try to shorten the queuing time that the confirmed cases will be in at home. And for the cases who test the rapid test positive at home, I still hope that they can be try the best to stay at home, and also if they can find someone else, or maybe throughout some logistic support to have the deep-throat saliva test. And moreover, I would like to stress on the infection control measure at home. Firstly, on the personal hygiene, including the hand hygiene and also the surgical mask, better with double mask, and also the environmental control. Namely keep a good ventilation, and also try to minimize any sharing or any other meal time with the relative or any other family members.
So you can see in the previous several waves of the COVID spread in Hong Kong, we are changing and adapting our strategy to cope with the situations. And in this current fifth wave, you can see there are there are many measures, public health measures that we are strengthening up to cope with the situation, like the testing capacity. So the testing capacity in Hong Kong, previously there are about 100,000 tests a day. So with the help of the private collaborators, we are enhancing our capacity to, we hope, to nearly 200,000 per day. But I think the current situation is that we still need the assistance from our mainland counterparts. I think in mainly two parts. One is the testing capacity, and also the second is the isolation facilities. So I don't have the outcome of the discussion as of now, but I think we'll leave our colleagues after the communications with the mainland delegates and experts to report later on the outcomes of the discussions.
Hi. Next, please. Over here, second last row, the one in blue. I'm from RTHK. Now, for Omicron cases, most people could recover. And because there are some who have to wait a week and they're still not admitted to hospital. So there are cases that people have recovered before they're admitted to hospital. Do you have such numbers? And then for cases with mild symptoms, would you provide them with some relief medication or maybe rapid antigen test kit so they could just stay at home and they don't need to be hospitalized? And then on testing, are you going to arrange for the ticket machines for all the testing stations? On distribution of deep throat saliva bottles, many have said they are not able to get the bottles. Are you going to increase the supply of such bottles?
I think I will invite Dr. Lee to tell us more about the treatment of Omicron cases. I will address the point about testing. I hope you can understand that for some preliminary positive cases, they're staying at home. We'll try to improve things on that front because cases are surging rapidly. In terms of treatment, we didn't have enough space. Back then, Penny's Bay was just for quarantine, but now we're vacating the facility at Penny's Bay. It's now turned into a community isolation center. What we have to do now is to send confirmed patients to such facilities. This situation will not be here forever, but we're trying to make improvements. Some patients have to stay home for the treatment, but that's temporary. Over to Dr. Lee, who will tell us more about the treatment. For Omicron cases, the average hospital stay is roughly 17 days. But now we've been revising discharge criteria. Those who meet the criteria, we're seeing a shorter hospital stay, but we don't have the specific data. For patients waiting for hospital admission at home, that's not an ideal situation. But with more measures being rolled out, such as the transport of patients to different facilities or hospitals, and there may be room in Penny's Bay to accommodate more patients, then improvements will be made and we will be able to send patients to hospitals more quickly. In terms of testing and the support measures, there has been keen demand for testing, and there has been a long queues outside testing stations. So now we have new measures, ticket dispensers, for example. We will review the effectiveness of such ticket machines, and if need be, we will set up more ticket machines and more testing locations to relieve the pressure on testing facilities. We target the highest risk places, and we impose the compulsory testing notices there. But the public needs to be aware that going out comes with a risk, so try to stay home as much as possible. In terms of our testing capacity, we need to ramp up the testing capacity given how COVID is going. In the long run, we need to keep close tabs on the testing capacity and where cases are going, how to make it easier for people to get tested. Next question. The speaker's not using a microphone. I don't have the data. Next question. The last row, the lady in white jacket. Ming Pao. Question for the CHP. The Department of Health reaches out to patients. How many people are there working at the office? Given that cases are surging, does it mean that the office is overwhelmed? Will you deploy additional manpower or you recruit more help from elsewhere? Second question about the residential care homes. Dr. Choi told us that as of now, 42 care homes involving 80 staff members or residents have been infected. Do we have a breakdown of the number of staff members and residents who got infected? How many additional care homes have we seen with infections today? Is it just the 7 mentioned by Dr. Chuang? I want to follow up on the death cases. For the 3 people who passed away, which variant of COVID did they catch? For the patient at Tuen Mun Hospital, did he get vaccinated? Which kind of vaccine? And for the 4-year-old boy, does the CHP know whether this boy has sought medical attention? Has he been tested? Did the boy keep hamsters or other pets at home? Final question for the CHP. Do we know if the boy has not been going to doctor even though after being ill? How many children have come down with COVID? How many hospital beds for children are there? And what's the occupation rate? And what will be the treatment be like for children? What kind of medicine will be available? And for Penny's Bay and Asia World Expo, can you give us also the occupancy rates for the Tier 1 and Tier 2 beds? Dr. Chuang can may be able to give us more details about the figures about the elderly care homes. And Dr. Larry Lee may be able to give us more details about the cases. I'll talk about how the Department of Health reaches out to patients. The CHP has a lot of people to reach out to. When we have cases, the first people we have to contact, we have this contact tracing office who will reach out to patients. The contact tracing office will try to get the information about the places the patient's been to. And then they will look at the places they've been to and the people who may have been affected, people who may have been exposed to a COVID patients. That's the first kind of information we need to get. Next, we need to determine who will be the close contacts and who will have to be quarantined. Our contact tracing office is in charge in that. We have 3 such contact tracing offices. More than 600 staff members are working at these 3 offices. When we have cases, we've also arranged with hospitals for these people to be sent to hospitals, but for their close contacts, there's home quarantine arrangements going on now. So we will have a separate team reaching out to these people, telling them that we will have an auxiliary medical team, providing them with a pack with thermometers and other things. These things will be delivered to the home of these people. We also have colleagues checking with these people about what their home settings are like. They will also check with them the rapid test results. So that in the next 14 or 4 days, we will have different staff members getting in touch with these people. Once the quarantine is completed, then that's completed. But before the completion, the people under quarantine will have to put on a bracelet. Our staff from the OGCIO will also reach out to these people about these things. So there are different tasks involved, and we'll have different colleagues reaching out to the people involved. Each colleague, and we have been deploying additional manpower depending on the need. Over to Dr. Chung for the care homes, Dr. Boy. On the 9th, he developed fever. On the 11th, he was taken to a hospital. He has not visited other doctors. As for the elderly care homes, 50 or so people are involved here, but the figures are subject to change as we get more information. As for cases of fatalities, 19609 unvaccinated for the one at Tumen Hospital. I don't have the information about his vaccination status. As for the COVID variant, I don't have that information. As for children who have been infected, we're concerned about them. The same goes for the elderly. Most of them have not been vaccinated, and they tend to lack the immunity, so we prioritize treatment for them. For negative pressure beds and wards, they have close to the point of saturation, so we enlist the help of experienced pediatricians and nurses experienced in looking after children, and we deploy them to the North Lantau Hospital. We hope to set aside an area for children with COVID. As for Penny's Bay, more than 500 patients are at Penny's Bay, but we have different colleagues working very hard to take patients to Penny's Bay so that they can be isolated. Speakers not using a microphone. Speakers not coming through. For the Asia World Expo Community Treatment Facility, there are 650 patients there. As for our Tier 1 and Tier 2 hospital beds, the occupancy rates are close to 85%. I'll give a rough figure. Roughly 50 residents at the elderly care homes have been affected in this wave of outbreak. Roughly 50 workers at these facilities have been infected, but these are just ballpark figures. We'll take the last question. Any question? The one at the far end. Phoenix TV. Question for Dr. Choi. We're seeing more and more cases over the past couple of days. Now that the COVID restrictions have been tightened, do these restrictions work? Are these measures ineffective so that we're seeing so many cases? We are also seeing things that are undesirable. Look at public transport. People are still gathering on public transport. Will the vaccine pass be extended to cover public transport? Yesterday, Dr. Chuang told us many districts in Hong Kong have seen many infections. Sham Shui Po is just one example. There are many infections in the district. Many elderly care homes have also seen infections. Will the government consider sealing off the Sham Shui Po area? The social distancing measures have been introduced, and they work to an extent. We do see an increase in daily case count, but we're not seeing exponential increases. Indeed, we're seeing more and more cases by the day, but we have to look at how the daily case count changes over the next few days. even with the restrictions, indeed we're seeing people gathering. So we have to rely on people's cooperation and self-discipline. Do not underestimate the impact of COVID. We will keep close tabs on the case numbers, and if needed, there may be tougher measures. In the past, we have seen a situation where many cases are identified in a building, so that an entire building or a larger area have to be sealed off to prevent infections from spreading to other areas. We have taken such measures. So we have to look at things holistically. And then we base our decisions on such review. The current social distancing measures have been rolled out, and if there's lack of public cooperation, so there might be tougher measures down the road. That concludes our press briefing today. Thank you.